A new type of MRI machine has been approved by the FDA. How is it different? Welcome to another Techstination interview. I'm Fred Fishkin. Joining us is Dr. Orlando Simonetti, professor of internal medicine and radiology at the Ohio State University College of Medicine. Thanks for taking the time with us, Dr. Simonetti.
Yeah, thanks for having me on, Fred. Happy to talk to you.
Well, the medical center there is the first in the nation to install this new type of MRI machine that you and your team have worked on developing along with Siemens, I think. So tell us what some of the key differences are from what's been available until now.
Sure, yeah, so the key difference with this machine, so this is the Siemens Magnetome FreeMax system, it's called. It's actually a 0.55 Tesla magnetic field strength, which is lower than what's typically used now. The modern MRI scanners are mainly at 1.5 Tesla or 3 Tesla magnetic field strength. So Siemens introduced this past year this new low field system. It's got a number of potential advantages over higher field systems. There's I guess the primary disadvantage, if I want to start with that, is the lower the magnetic field strength, the less MRI signal is available to form our images, right? So that's why there's been a push towards higher field. But low field brings a number of advantages. One is just the cost, the size and weight of the machine are all reduced. The lower the magnetic field strength, the less expensive the system, the less expensive it is to install, and the magnet configuration can be more flexible at lower field. So this machine, the FreeMax, has an 80 centimeter diameter patient bore, so it can accommodate severely obese patients and also claustrophobic patients more easily than the standard systems, which are more typically 60 to 70 centimeter patient bore. Lower field also offers some kind of MR physics advantages in scanning lung tissue, for example. So the lungs obviously are mostly air, and the MRI signal that we get is from water for the most part. And where there's a mixture of air and water like there is in the lungs, that can cancel the signal out at higher field. And there's greater potential at low field to do lung imaging with MRI, which has not been a mainstay for MRI. And then also advantages in patients with implanted devices like pacemakers and defibrillators. It has been shown over the past few years that patients with these devices can be scanned safely at 1.5 Tesla, but there can still be considerable artifact in the images caused by the metal of these devices. The metal distorts the magnetic field and can distort the images as well. And that effect is less so at lower magnetic field strength. So our partnership with Siemens is really to develop cardiovascular imaging techniques for this scanner, for this low field machine in particular.
And the advantages there with the cardiovascular imaging?
Yeah, a lot of it gets at the advantages that I mentioned. That is, a lot of our patients have implanted devices if they have cardiovascular disease. So, better image quality in those patients, and obesity and cardiovascular disease go hand in hand as well. So the ability to scan those severely obese patients where not only is MRI not an option for them oftentimes, but other imaging modalities like ultrasound and CT are not as effective in those patients as either. So we've got NIH funding coming in to focus our research efforts just on that population of severely obese patients with heart failure, and using this machine to hopefully produce better diagnostic images for that population.
And I understand you're working with a children's medical facility as well.
Yeah, I didn't mention that as another potential advantage for low field, is the ability to do MRI guided interventions. So rather than using X-ray fluoroscopy that's typically used to do heart catheterizations, is to do that kind of work under MRI guidance. And again, there's been work on that at higher magnetic field, 1.5 Tesla typically, but lower field offers the potential to use off-the-shelf guide wires for these procedures, and those guide wires would not be safe to use at higher field. So there's been a lot of work to try to come up with devices that could be safe to use at higher field, but the low field system offers the advantage of using off-the-shelf equipment. And we're collaborating with Nationwide Children's Hospital and Dr. Amy Armstrong to develop those techniques. There's been work done already at the National Heart, Lung, and Blood Institute in Bethesda with a prototype low field scanner to show the safety and potential for these MRI guided interventions.
Would this serve as a replacement for MRI machines in use today, or would it be used in addition? What's the market?
Yeah, I mean, here at Ohio State, now we have 3 different field strengths, 0.55, 1.5, and 3 Tesla, all dedicated to cardiovascular imaging, both clinical and research imaging, which is really a unique situation. But our plan here is to really direct, the patient to the right machine for them. So one of our systems, the 1.5 Tesla, is in the heart hospital, so it's well positioned to image the inpatients there. The 3 Tesla machine, that offers superior signal and resolution for MR angiography, MR myocardial perfusion imaging, for example. And then the low field has these advantages I mentioned. So I don't see it as replacing other field strengths, but really each machine has its own advantages and disadvantages.
Does the lower strength translate to being less expensive?
Yeah, definitely. The cost of the magnet, that is the MRI scanner, it increases with field strength. So I don't know specific pricing, but it'll definitely be a lower cost unit than 1.5 or 3 Tesla.
The research that you've been doing there, there's a personal aspect to it as well, I understand. Your wife, Lynn, was diagnosed with heart failure?
That's right. Yeah, about 5 years ago, she was diagnosed with heart failure, and MRI has played a key role in her diagnosis and really tracking the success of her heart failure therapy, which has been tremendous. She does have an implanted pacemaker device now, and she's also severely claustrophobic. So this machine, between the lower field to reduce the artifact of the pacemaker and also the more room to make her more comfortable when she gets scanned, I think will be ideal for her. We haven't had her in there yet, but I'm sure soon we'll be testing things on her as a patient.
And just to wrap things up, the new machine, you're saying there are advantages, some big advantages to it, and also the disadvantages would be on the imaging side, that you're not getting as much detail, or how would you explain it to a layperson?
Right. So it's reduced signal. So that translates into reduced signal to noise. I guess the best way to describe this, if you go back to the old days of TV, I guess after they signed off at night, there would be this screen full of noise, right? It's just like the snow pattern on the screen. That's the kind of noise we're talking about, and we need to get signal to overcome that, to rise above that noise, basically. And there's less of that at low field. But what really spurred our interest in this a number of years ago now is that we have ways now to overcome that, to boost that signal to noise on the software side. So it doesn't take, a higher field strength, more expensive, bigger hardware to get that signal. Instead, we can use intelligent ways to reconstruct that noisy data into images. That's what spurred our interest in this some years ago, where we saw the techniques we were developing for higher field. There we were using these methods to accelerate the data acquisition, so to reduce the scan time. Here we're using it to boost the signal to noise, the same kind of reconstruction approaches. So we're thinking we can really overcome those deficits and get diagnostic quality images. They may not have the same resolution, but in many cases, that's not needed to answer the clinical question.
Terrific. Well, congratulations on the work that you're doing there. Dr. Orlando Simonetti, thank you for taking the time with us.
Okay, thank you.